This podcast was AI generated based upon materials written by Professor Elizabeth Capron on behalf of Eaglegate College. Copyright is retained.
All right, welcome to another deep dive. And if you're tuning in, I bet you're probably a nursing student getting ready for the ED.
Yeah.
And we're talking about the emergency department.
Right.
That's right.
Yeah.
And we're talking about the emergency department.
Right.
That's right.
Absolutely.
So we're looking at some of the study materials that you guys shared with us, and we want to pull out some of those essential nuggets that are going to make a difference when you're out there in the real world.
Absolutely. And what's exciting about the ED is that it really challenges you in every way as a nurse.
Oh, for sure.
Critically, and of course, you have to have excellent nursing skills.
So let's jump right in.
Yeah.
What is emergency nursing? We always use that term, but what does it
Uh-huh.
really mean? What makes it special?
Well, emergency nursing is really about being the first line of defense for patients who are experiencing some kind of acute crisis, decisions and interventions that could actually save lives.
Yeah.
And it's not just about knowing the procedures, it's about performing them under pressure.
Right. So this isn't just about,
Yeah.
studying for a test and memorizing facts.
Exactly.
This is about being able to make decisions in a split second.
Absolutely. And, it's not always those dramatic trauma cases that you see on TV. You could have a patient in respiratory distress,
Right.
which requires a different skill set, but can be just as critical.
Absolutely.
Hmm.
I think that's a really great point about the variety of cases that you see in the ED.
Yes.
And, it's funny because I always thought that the ED was just for those life or death situations.
Right.
Like that the ED was just for those life or death situations.
Right.
Like really intense stuff. But actually, these sources are painting a little bit of a different picture.
Yeah, the ED has actually become a safety net for people
Oh,
who don't have access to regular primary care.
okay.
So you might see anything from a really minor laceration to a chronic condition that's worsened.
Yeah.
So as a nursing student, that means you need to be ready to switch gears all the time.
Yeah, that's got to be really challenging.
Absolutely.
Even for, seasoned nurses.
Right.
And these sources had some really great practical advice for how to handle that.
Yeah.
Like that unpredictable work.
Well, one of the big things was mastering triage.
Okay.
Now, when you're a student, you might think of triage as just sorting patients, but it's much more than that.
I see.
You're always reevaluating and prioritizing based on the needs of everyone in the ED.
Wow.
It's a lot.
That sounds really demanding, especially for someone who's just starting out.
It is,
Yeah.
but they're experienced triage nurses whenever you can.
Okay.
See how they get the information, how they talk to the team, and how they make those decisions under pressure.
That's great advice. So nursing students out there, don't be shy.
Right?
Ask those experienced nurses to, walk you through their thought processes. You can really learn a lot from them.
Absolutely. It's a masterclass. Absolutely. It's a masterclass in ED triage.
Right.
And another thing that was emphasized was good documentation. In the whirlwind of the ED, clear and concise charting can be a lifesaver.
Okay. I can see how that's important. But as a nursing student, how do you make sure that your documentation is good? How do you make sure that your documentation is good in that fast-paced environment?
Well, the sources highlighted something called the SBR technique.
Okay.
Have you heard of that?
I haven't.
So it's Situation Background Assessment Recommendation.
Okay.
It helps you to communicate clearly and effectively in a crisis.
So instead of just like writing down random notes,
Yeah,
you're using work.
absolutely. It paints a clearer picture for the team,
Yeah.
and you can start practicing that right now,
Right.
even in your clinical rotations.
Okay, so nursing students add that to your study toolkit,
Yeah.
the SBR technique.
Yes.
And speaking of skills, these sources, they really emphasize how important teamwork is in the ED.
Teaming with doctors and nurses, you've got respiratory therapists, radiologists, pharmacists, social workers. It takes a village.
It really does. It's a whole symphony of healthcare professionals.
Yeah, it is.
So it's not enough to be a great nurse.
Right.
You have to be a great team player.
Exactly.
What do they say about effective teamwork?
One of
What do they say about effective teamwork?
the most important things is closed-loop communication.
Okay.
That means you don't just give an order or information, you make sure the other person understands and acknowledges what you said.
Yeah.
It seems simple, but it can prevent a lot of mistakes.
Right.
Especially when you're in the chaos of the
Right.
Especially when you're in the chaos of the ED.
Yeah. It's like that old saying, assume makes an ass
Exactly.
out of you and me.
Absolutely.
Right.
And another key thing is knowing your role
Oh,
and knowing the roles of everyone else on the team.
yeah.
That way you're not stepping on each other's toes And you can use everyone's expertise to take care of the patient.
Those clinical rotations?
Yeah.
Watch how all the different roles in the ED work together.
It's a beautiful dance.
Yeah, it is. It's like a choreographed dance.
It is.
So we've got triage, documentation, teamwork. What else stood out to you about those essential ED skills?
Well, one thing that emphasized was
Well, yeah, time is of the essence.
it is.
But how do you balance that with, making sure that you're not missing anything?
Right. Well, they talked about a couple of key techniques.
Okay.
One is the primary survey.
Okay.
That's a rapid assessment to
Yeah.
make sure that there are no immediate life threats.
Okay.
You're focusing on airway breathing, circulation disability, and exposure.
So it's like a quick scan
Yeah.
to make sure that the patient is stable
Exactly.
before you go on to a more detailed assessment.
And it's systematic. So you follow the same steps every time, so it helps you to stay focused under pressure.
I see. So that would be really helpful for a nursing student,
Absolutely.
especially when you're in those initial moments and you're trying to, figure out what's going on.
Under pressure.
I see. So that would be really helpful for a nursing student,
Absolutely.
especially when you're in those initial moments and you're trying to, figure out what's going on.
Exactly. And then there's also the focused assessment,
Okay.
where you focus on the specific body system related to the patient's chief complaint.
So if a patient comes in with chest pain,
Right.
you'd focus on
that.
Yeah.
So you have to use your knowledge and critical thinking skills to zero in on what's most likely causing the problem.
So much great information
Right.
for nursing students.
Yeah.
So we've got triage, documentation, teamwork, rapid assessments.
Yes.
Emergency nursing is a constant juggling act.
It is adapting and using your skills to really make a difference in people's lives.
Okay, before we move on, I do want to talk about safety for a second.
Yeah.
We're not just talking about patient safety, but also the safety of the staff.
You're right. The ED can be a volatile environment.
Yeah.
You never know what's going to happen, and the sources really emphasized being prepared. You know what's going to happen, and the sources really emphasized being prepared.
So what kinds of things should nursing students be aware of?
Well, one of the most basic things is personal safety.
Yeah.
You always have to be aware of your surroundings.
Yeah.
Trust your gut and don't hesitate to call security if you feel unsafe.
That's a good reminder because
Hmm.
it's easy to get caught up in the urgency of patient care
Exactly.
and forget about yourself.
Absolutely.
But you have to take care of yourself too.
You do. And the sources also talked about following the safety protocol.
Yeah.
Things like hygiene needle handling, using PPE,
Right.
all very important
But it sounds like they take on an even bigger,
in the ED.
bigger significance in the ED.
Because you're seeing such a wide range of patients, you never know what you might encounter.
Makes sense? So nursing students pay attention to those lectures on infection control.
Yes,
They're really important,
they are.
especially in the ED.
Absolutely. And another key aspect is lifting and moving and positioning patients,
Yeah,
which can be tough on your body.
it can, and it can lead to injuries if
Absolutely.
you're not careful.
So the sources really talked about proper body mechanics, like lifting with your legs. And not being afraid to ask for help.
Yeah, don't be a hero.
Exactly. There's no
Hero.
Exactly. There's no shame in needing an extra pair of hands, especially if you're dealing with a heavy patient.
Yeah, so teamwork isn't just about patient care.
Right.
It's about keeping each other safe.
It is. And that brings us to preventing falls.
Okay.
Falls are a big concern in the ED.
I bet, especially with patients who are
Falls are a big concern in the ED.
disoriented.
You're right. So they talked about fall risk assessments,
Yeah.
tools that help you figure out who's at risk and what precautions to take.
So like bed alarms and stuff.
Exactly. Frequent checks, making sure there's no clutter,
Right.
helping them to walk.
It's about being proactive. Risks.
And you can practice these things now, even in less acute settings.
Right. So pay attention to fall prevention protocols,
Yeah.
even if you're not in the ED yet.
It's about building good habits.
Great point. So we've had a great discussion about safety in the ED. Any last thoughts before we move on?
Just remember that safety is everyone's responsibility. Safe, speak up,
Right?
whether it's for you, a colleague, or a patient.
That's great advice.
Yeah.
It's all about creating that culture of safety.
Absolutely.
So we're all in this together.
We are now. Let's talk about something that can be really challenging,
Okay.
especially for people new to the ED.
Yeah.
Anxiety.
Anxiety.
The
Yeah.
ED is a very new to the ED.
Yeah.
Anxiety.
Anxiety.
The
Yeah.
ED is a very stressful place
It is.
for everyone.
Yeah.
Patients are often in pain.
Yeah.
They're scared. They don't know what's happening.
Right.
Their families are worried, sometimes frustrated.
Yeah.
And let's be honest, honest,
Yeah.
healthcare providers feel the pressure too.
Absolutely. So there's this collective Absolutely. So there's this collective anxiety
Yes,
that's swirling around the ED.
there is.
How do we as nurses learn to navigate that and
Oh.
actually help people manage their anxiety in that setting?
Well, the sources talked a lot about therapeutic communication. It's not just about what you say,
Right.
but how you say it. Calm, reassuring voice can do a lot to de-escalate a situation.
Oh, for sure.
You're setting the tone
Yeah.
for the interaction.
Exactly.
And another key thing is active listening.
Okay.
Really taking the time to hear what the patient and their family are saying.
Right.
Not just with your ears,
Yeah.
but with your whole...
Own.
Yes,
Make eye contact
absolutely.
and really focus
Yeah.
on what they're trying to tell you.
And even if you can't fix the problem right away, just acknowledging their feelings and
Yeah.
letting them know that you're there for them can make a huge difference.
You really can. It's about validating their emotions.
It is.
Even if you can't, offer any solution.
Absolutely.
Yeah.
And sometimes just giving them a clear and simple explanation can help.
Oh.
The ED can feel like a black box for patients.
It can. Yeah.
They don't know what's happening, how long they'll have to wait.
Yeah.
By keeping them informed
Yeah.
and answering their questions honestly,
Yeah.
you're giving them a sense of control, right?
That's a great point. It's like you're shining a light into that black box
Exactly.
and, taking away some of that mystery.
Absolutely.
And that could be very reassuring.
It can. And another technique is distraction.
Okay. How do you distract somebody in the ED?
Well, it depends on the patient and the situation.
Yeah.
But even just talking to them about something non-medical,
Right.
like their hobbies or their family, can be a welcome distraction.
Sometimes the simplest things are the best.
They are. And let's not forget about involving the family.
Yeah.
It can really help to support the patient.
We've talked about family involvement before.
Yes,
But I can see how it would be especially important when you're dealing with anxiety.
absolutely. Families can help calm the patient down, reassure them, and advocate for their needs.
So it's not just about treating the patient, it's about supporting their whole support system.
It is. And by creating that sense of partnership,
Yeah.
you're helping the patient manage their anxiety and you're building trust. So important.
This has been a great conversation about anxiety in the ED. Any last thoughts?
Just remember that anxiety is normal.
Yeah.
Our job isn't to get rid of it completely,
Right.
but to help people cope with it in a healthy way.
I love that. It's about giving them the tools
Yeah.
that they need.
And remember, we're all in this together.
Yeah,
The ED is a tough place to work.
it is.
And it's okay to feel stressed or anxious sometimes.
Yeah.
Don't be afraid to reach out to your colleagues for support.
That's a great reminder. Take care of yourself.
Yes.
All right, so we've talked about a lot. Triage, documentation, teamwork, rapid assessments. Anything else that you think is really essential for nursing students to know about the ED?
Yes. I think the most important thing is to have a holistic approach to care.
Okay, tell me more about what that looks like in the ED.
It's about recognizing that the patient is more than just a set of symptoms or a diagnosis.
Yeah.
They're a whole person with thoughts, feelings,
So it's about seeing the person
Absolutely.
behind the patient.
It is.
Yeah.
And that means taking the time to understand their needs, their preferences, their culture, their support system,
I see.
their goals for care.
That's tough to do in the ED
It is.
when things are moving so fast.
It is.
So how do you actually do that?
Well, one
Moving so fast.
it is.
So how do you actually do that?
Well, one strategy is to just ask them about their concerns and priorities.
Okay.
What are they most worried about? What are their goals for their visit? What do they expect from their care?
So instead of just assuming we know what's best.
Exactly. We're taking the time to listen to them.
Right.
It doesn't take a lot of time.
Okay. Them that you care about them
It does.
as a person, not just a case.
Absolutely. And another important aspect is recognizing the social determinants of health.
Okay, right. Remind me what that means.
Yeah. So that's things like their income, their housing situation, their access to transportation, their education.
Right. All those things that can affect a person's health.
Education.
Right. All those things that can affect a person's health.
Absolutely. And in the ED, we see the consequences of those things firsthand.
Yeah.
For example, someone who's homeless might not seek care until they're very sick.
That's so sad.
It is. So what can we do as nurses?
Yeah, because we can't solve poverty or homelessness.
Right. But we can connect them with resources that can help them,
Yeah.
like food banks, shelters, or transportation assistance.
Okay.
And we can also be aware of their cultural beliefs and practices
Yeah.
that might influence their decisions.
That's a great point. We need to be culturally sensitive
We do.
and respectful.
For example, some cultures have different views about pain management
Right.
or end-of-life care.
Right.
So we have to be aware of those differences and communicate effectively.
Yeah, this has been such a great discussion about holistic care in the ED.
It has.
Any final thoughts?
Just remember that every patient is an individual with their own story. And by taking the time to listen to a whole person, we can provide really compassionate and effective care.
Beautiful.
Yeah.
That's a great reminder that nursing is about so much more than just treating the physical symptoms.
It is.
It's about caring for the whole person.
Absolutely.
And that's what makes emergency nursing such a challenging
And rewarding.
and rewarding profession.
It is.
Okay, so future nurses, we've covered a lot in this first part.
We have.
Essential ED skills, safety measures, managing anxiety, and the importance of a holistic approach.
Yes,
There's still so much more to explore,
there is.
but we'll get to that in the next part of our deep dive.
We will.
So there's still so much more to explore,
There is.
but we'll get to that in the next part of our deep dive.
We will.
So stay tuned.
We'll be back.
Welcome back to the deep dive. We've already talked a lot about what makes emergency nursing unique. We're just getting started. Before the break, we were talking about holistic care.
Yeah.
Treating the whole person,
Mhm.
not just the immediate medical, about how that plays out when you're working with families in the ED.
Yeah, families can be tricky in the ED.
How so?
Well, on the one hand, they can be a great source of support.
Yeah.
They can give you crucial information about the patient.
Right, like their history or allergies.
Exact things you might not be able to get from the patient themselves.
Right, out of it to really communicate.
Exactly. So in those cases, the family becomes like an extension of the care team almost.
Yeah.
But on the other hand, families are often under a lot of stress themselves.
Wow.
They might be overwhelmed, confused, even angry.
Right.
And sometimes those emotions can make it difficult to provide care.
So it's like you're walking a tightrope.
Yeah.
You're trying to be supportive and empathetic to the family,
Right.
but you also have to maintain professional boundaries
Absolutely.
and make sure the patient's safety comes first.
One of the sources actually used the analogy of a tightrope walker,
Oh, wow.
which I thought was really fitting.
It is. Yeah.
You're always trying to find that balance.
Yeah. And in control.
Exactly.
So what did these sources suggest for handling those tricky situations?
Well, they emphasized clear and consistent communication.
Okay.
A lot of times, families get upset because they feel left out of the loop.
They don't know what's going on.
Exactly. They don't know what's happening, why things are taking so long, what the next steps are.
Right. So it's about keeping them informed,
Yes.
even if it's just a quick update.
Even a simple update can make a big difference.
Like, hey, we're still waiting on those lab results, but I'll let you know as soon as we have them.
Exactly. Just acknowledging their concerns and letting them know that you're listening
Yeah.
and communicate with the family.
Okay, so 1 point person.
Yes. That way you avoid confusion and conflicting information.
So maybe one nurse updates the family while another focuses on the patient's care.
Exactly. It just streamlines things.
Yeah. Makes sense.
Yeah.
These are great tips. So nursing students, when you're in your clinical rotations, pay attention to how those interact with families.
Yeah,
It's a skill that takes practice.
it does. Now, speaking of skills, the sources also talked about managing your own stress and anxiety in the ED.
Oh, yeah, that's a big one.
It is.
I remember my first few shifts in the ED, it was like sensory overload. All
Yeah.
the beeping and rushing around.
It's intense.
Overload. All
Yeah.
the beeping and rushing around.
It's intense.
It is. It's a lot to take in.
One source described it as a pressure cooker.
Ooh, yeah, that's a good way to put it.
So how do you not get burned?
Right. What do they say about staying cool under pressure?
Self-care is huge,
Okay.
both on and off the clock.
So making sure you're getting enough sleep. Ways to de-stress outside of work?
So you can come to work and be your best self.
Absolutely. And during your shift, they said it's important to take breaks when you can.
Yeah, even if it's just for a few minutes.
Even 5 minutes to step away and breathe
Yeah.
can make a difference.
And they also suggested finding a mentor or colleague you trust.
Right.
Someone you can debrief with after a tough...
Who gets it?
Exactly. Someone who understands the pressures of the ED.
This has been a great conversation about the emotional side of emergency nursing.
Yeah, it's not all about the technical skills.
Right. It's about taking care of yourself, too.
Absolutely. Now let's talk about some specific skills and knowledge that are essential for the ED.
Okay, perfect timing.
Yeah.
Because we've touched on some of these already.
Knowledge that are essential for the ED.
Okay, perfect timing.
Yeah.
Because we've touched on some of these already.
Right.
But let's dive a little deeper.
Okay, one area they really emphasized was strong assessment skills.
Makes sense.
You often have very little time to gather information and make decisions in the ED.
Yeah.
So being able to assess a patient quickly and accurately is crucial.
So it's not just about knowing the textbook stuff.
Right.
It's about being able to apply it in the real world.
Exactly. And one of the key assessment skills they highlighted was auscultation.
Oh, you mean listening to heart and lung sounds?
Exactly. It seems basic,
Yeah.
but it takes practice to really master.
Yeah. So nurse sounds.
Yeah.
Learn what's normal and what's not.
And practice describing what you hear.
Yeah, to your instructors.
Absolutely.
And preceptors.
Another skill they stressed was IV insertion.
Oh, yeah, that's a big one.
You need to be able to do it quickly and efficiently.
Especially when you're dealing with a critically ill patient.
Absolutely.
Yeah.
So practice every chance you get.
Yeah. In your clinical rotations.
The more you do it, the better you'll get at it.
Do they have any specific tips for IV insertion?
Oh, yeah. They talked about patient positioning, using good lighting, taking the time to find a good vein.
Okay.
They even had some tricks for difficult veins,
Like what?
like using a warm compress or having the patient down.
To increase blood flow.
Exactly. It's like a cheat sheet for successful IV insertion.
Love it.
And another skill they mentioned, which might not be as glamorous but is just as important, is wound care.
You mean cleaning and dressing wounds?
Exactly. The ED sees all kinds of wounds.
Yeah, from little cuts to big gashes.
Exactly.
Gashes.
Exactly. So it's not just about putting on a Band-Aid.
Right.
There's a real art to wound care.
So what do they say about that?
Well, they talked about proper cleaning techniques.
Okay.
Knowing when to suture or staple a wound.
Yeah.
And understanding different types of dressings.
Okay, so pay attention during those wound care lectures.
Absolutely. Those skills will come in handy.
For sure.
Now let's talk about something that can be a little intimidating.
Yeah.
EKG interpretation.
Oh, yeah, the electrocardiogram.
Yes, that squiggly line that tells us about the heart's electrical activity.
It's like a secret code.
It is, and in the ED, you need to be able to crack that.
Not enough to just hook the patient up to the machine.
Right, you have to understand what those squiggles mean.
Right.
So the sources talked about learning the different parts of the EKG waveform,
Okay.
recognizing normal versus abnormal rhythms,
Yeah.
and understanding what the findings mean.
That's a lot to learn.
Yeah.
Any tips for our nursing students who are feeling overwhelmed?
Use online resources or textbooks
Yeah.
and get feedback from experienced nurses or cardiologists.
So it's like any skill.
It is.
The more you practice, the better you get.
Exactly. And don't be afraid to ask for help.
Right.
Even experienced nurses sometimes need a second opinion.
Great advice.
Oh.
So don't let those EKGs intimidate you.
Right.
Nice.
Oh.
So don't let those EKGs intimidate you.
Right.
Just practice and ask questions.
Now let's shift gears and talk about medication administration.
Oh, yeah, that's where it all comes together.
It is, you're not just giving pills here.
Right, we're talking IV meds injections.
Exactly.
Yeah.
And in the ED, it's often time sensitive. Exactly.
Yeah.
And in the ED, it's often time sensitive
Yeah,
and high stakes.
but you got to get it right.
So what did they say about mastering medication administration in the ED?
Yeah.
Know your meds inside and out.
Yeah.
Understand their uses, their side effects, their dosages, their routes of administration.
It's not just about memorizing drug names. Yeah.
And they also emphasize double-checking your calculations,
Really?
verifying the patient's identity,
Right.
and following the 6 rights of medication administration.
Right patient, right medication, right dose, right route, right time, right documentation.
Exactly. And in the ED, those 6 rights are even more important.
Because of all the distraction.
Attention to those pharmacology classes and simulations.
Yeah, they're really important.
They are.
They're not just busy work.
Right. They're preparing you for the real world.
Okay, speaking of preparation, the sources also talked about professional development,
Yes.
which I think is a great topic.
It is.
So how can nursing students start preparing themselves for a career in the ED?
Seek out learning opportunities.
Okay.
Volunteer in the ED shadow experienced nurses. Attend conferences.
So be proactive.
Exactly. Take charge of your own development.
Love it.
And they also suggested getting involved in professional organizations.
Oh, yeah, like the ENA.
Exactly.
Yeah.
The Emergency Nurses Association.
Right.
Involved in professional organizations.
Oh, yeah, like the ENA.
Exactly.
Yeah.
The Emergency Nurses Association.
Right.
Those organizations offer networking opportunities, continuing education.
It's like finding your tribe.
It is your tribe of emergency nursing superheroes.
I like that.
And they also said it's important to stay up to date on the latest evidence-based practice. The field is constantly changing.
Right. So it's not enough to just learn the basics in school.
Exactly.
You have to be a lifelong learner.
Yes.
This has been such a great discussion about the skills, knowledge, and professional development needed for the ED.
It has.
Any final thoughts?
Just remember that emergency nursing is both challenging and rewarding.
Yeah.
But it also gives back so much.
You get to make a real difference in people's lives.
You do.
At their most vulnerable moment.
Absolutely.
And you get to be part of a team that truly makes a difference.
And for those nursing students listening, don't be intimidated by the challenges.
Right.
Embrace them as opportunities to grow.
Seek out mentors, practice your skills, and never stop learning.
Exactly. Now, in the final part of our deep dive, we'll be exploring some of the ethical and legal issues that emergency nurses face.
Sounds fascinating.
Mm-hmm.
We'll be right back. Welcome back to the deep dive. We've talked about a lot, essential. Welcome back to the deep dive. We've talked about a lot, essential skills managing stress in the ED, but there's one more area that we need to explore.
Yeah.
And that's the ethical dilemmas that often come up in emergency nursing.
Right. In the ED, things happen so fast.
Yeah.
And you often have to make decisions with very little information.
Yeah.
And that can lead to some really tricky situations where the right thing to do isn't always clear.
So it's not just about knowing the rules.
Right.
It's about navigating those gray areas
Exactly.
where your ethics come into play.
Absolutely. What kind of ethical dilemmas did the sources talk about?
Yeah. What were some of the common ones?
Well, one that came up a lot was patient autonomy versus beneficence.
Okay.
So patient autonomy is all about respecting the patient's right to make their own decisions about their health care, even if those decisions go against medical advice.
I see.
Beneficence, on the other hand, is about acting in the patient's best interests, even if that means overriding their wishes sometimes.
It's like this tension between what we think is best for them medically.
Exactly. And in the ED, those two things can sometimes clash.
Yeah. Give us an example.
Okay. Imagine a patient comes in with a severe head injury.
Okay.
And they refuse a CT scan.
Oh, wow. That's a tough one.
Right. Because on the one hand, you want to respect their right. Right. Because on the one hand, you want to respect their right to refuse treatment.
Yeah.
But on the other hand, you know that a CT scan is really important to diagnose a potentially life-threatening condition.
Yeah, you could be missing something really serious.
Exactly. So what do you do?
Right.
There's no easy answer.
No.
The sources said it's important to communicate clearly,
Sure.
try to understand. The sources said it's important to communicate clearly,
Sure.
try to understand why they're refusing treatment, and maybe even involve the ethics committee.
Right. So you're not alone in making those decisions.
Exactly. You have resources to help you.
Okay. So it's about finding that balance.
Yeah.
Between respecting their autonomy
Right.
and making sure they're safe.
Another ethical.
The process of explaining the risks and benefits of a treatment
Right.
before the patient agrees to it.
Exactly. But in an emergency, it can be hard to get true informed consent.
Yeah, because the patient might be in pain
Right.
or confused or just not able to understand everything.
Exactly. So how do you make sure you're getting true informed consent?
Right.
The sources said it's important to use clear and simple language,
Okay.
avoid medical jargon,
Yeah.
and give the patient plenty of time to ask questions.
So you're really making sure they understand
That's
that they're
notes.
agreeing to.
And if the patient can't give consent because of their condition,
Yeah.
you might need to get consent because of their condition.
Yeah.
You might need to get consent from a family member or a healthcare proxy.
Okay, so someone who can make decisions for them.
Exactly.
This is also important. It's easy to forget about these things
It is.
when you're in the middle of a crazy ED shift.
But we can't lose sight of these ethical principles.
Absolutely. Now, what about confidentiality?
Oh, yeah. That's another big one.
Right, protecting patient privacy,
Exactly.
not sharing their information without their permission.
But that can be hard in the ED.
It can.
You're working in close quarters
Yeah,
with a lot of people.
right.
Information is flying around.
So how do you maintain confidence?
Sources said be mindful of your surroundings.
Okay.
Keep your voice down when you're talking about patients.
Yeah,
And only look at the charts of the patients you're actually caring for.
right. So no snooping.
No snooping.
Okay, good advice.
And then there's the issue of allocation of resources.
Yeah, that's a tough one.
It is.
When you have limited beds and staff and equipment.
Right? It's a tough question.
Yeah.
The sources said it's important to have a fair and consistent triage system.
Okay.
So you're prioritizing patients based on how sick they are.
So you're not playing favorites.
No, it's about following the protocols.
Right, and making sure the sickest people
Yes.
get treated first.
And sometimes you might even have to transfer patients to other hospitals.
If you did first.
And sometimes you might even have to transfer patients to other hospitals.
If your ED is too full.
Exactly.
Wow, those are some really tough decisions.
They are.
It sounds like emergency nursing isn't just about medical stuff.
It's not.
It's about having a strong sense of ethics.
Absolutely. You need a strong moral compass.
This has been such a fascinating deep dive.
It has. You need a strong moral compass.
This has been such a fascinating deep dive
It has.
into the world of emergency nursing.
We've covered so much.
We have from essential skills to managing stress
Yeah.
to navigating those ethical dilemmas.
It's a lot to take in.
It is. But I hope our listeners are feeling inspired
I hope so too.
to take on this
Journey.
So as we wrap up, what's the one piece of advice you would give to aspiring emergency nurses?
Embrace the challenges. Emergency nursing is not easy.
It's not.
It's demanding, it's fast-paced, it's unpredictable,
Yeah.
but it's also incredibly rewarding.
Yeah.
You get to make a real difference in people's lives.
Yeah.
And you're part of a team that truly makes a difference in the world.
Absolutely. And remember, you're not alone on this journey.
You're not.
Find mentors.
Yes,
Build a strong support network
absolutely.
and never stop learning and growing.
Couldn't have said it better myself.
Well said. Thanks for joining us on the deep dive. Best in your future careers.
You got this.
That's right. You got